On here with Active Therapy Seminars, just here to do a quick demonstration on an assessment that we can do for pelvic position, and then a drill that we can do to normalize that before we do our soft tissue treatments. All right, and the first question is, what does pelvic position have to do with soft tissue work? All right, I'm going to use the example of a tight hamstring. Okay, if we have a client that has tight hamstrings on the table, perhaps they can't lift their legs up, but then they can't touch their toes, and we know that they're in some degree of anterior tilt. The hamstrings are being stretched, and as a result, the nervous system is going to tone those areas up to just anchor the pelvis in place. And so if we release that tone and we leave the person in the same state, we've taken away their last line of defense for their pelvic position and further threat. So what we want to do, in addition to doing soft tissue work, is normalize that position to the best of our ability before we start to work on more distal structures. All right, so we're going to look at Dawn and we're going to see if she can touch her toes. All right, so I want you to actually stand up. Okay, we're going to put your feet together. And I want you to turn to the side here, Dawn. Okay, so two things that we're looking for here. A, can she touch her toes? And B, when she touches her toes, is her back position flat? Okay, go down, but don't fully touch your toes. Like, let's just pretend that you can. Dawn can do this. We've normalized her pelvic position many times. But let's say she can't do that, all right? This is a pelvis that's going into posterior tilt. So if we're limited to some degree, then we're going to have problems, all right? So for us, if we know that this is an issue, then we're just going to get her on her back real quick, okay? So let me have you just lie on your back, all right? And what we're going to do in this position is not stretch the hamstrings or release them. We're actually going to facilitate them in order to pull the pelvis back into a more posterior tilt, all right? So Dawn, what I want you to do is you're going to just take a deep breath in through your nose, try to fill your belly with air, and I want you to think about getting air in your rib cage as well as air all the way around in your back, all right? Just take a deep breath in and then exhale. Good. Just one more time. Just deep breath in. Try to fill all of this with air. And then exhale. Okay, so we want to coach in this diaphragmatic breathing. That's something that we'll cover further in our course. But now what I'm going to have her do is find a couple muscles. All right, so first and foremost, pressure back into the ground. Second, I want you to press your heels into my leg. Okay? And I always want to ask them, what do you feel? Okay, I want to make sure that she feels her hamstrings versus anything else. Can you feel the back of your legs?
Yes.
All right, now I'm going to have you lift your hips, pressure back into the ground, just lift your hips off the ground slightly to engage your posterior pelvic tilt. And now take a deep breath in through your nose and blow out hard as if you're blowing out a balloon. All right, we're just going to do that 5 times. Good, keep going. 2 more. Good, come down. All right, let's get you stand back up. All right, let's put your feet together. Reach down and touch your toes. Oh, look, now she can touch her toes. Come back up. And my point is that Dawn could touch her toes before. This is an example. But when you make a change and you test and retest, you will notice an immediate difference that gives us a better idea of what the mechanical position of the pelvis is, or the rib cage, or whatever we're assessing. But this is just a sample of what we cover in our course, and a practical example of something that you can do quickly in order to change the position of a proximal structure to get better results with distal extremities for soft tissue work. So this is Chris with Active Therapy Seminars and Dawn. We look forward to seeing you in our course.